The World Health Organization, WHO, has admitted that the Ebola outbreak in West Africa revealed inadequacies and shortcomings in how it responds to crises. Director General Margaret Chan told WHO's executive board in Geneva on Sunday that the organization had failed to deliver the necessary administrative, managerial, and technical responses to the outbreak. The WHO did not have the systems and capacities in place to respond to a health emergency that was both severe and sustained, she said. The organization saw its overall budget cut by a third in 2011, one reason given for its slow response to the Ebola outbreak, but Chan said there was also a need to make the body more streamlined. "We need to apply the one WHO approach," she told the executive board. All three levels of the organization must use the same standard operating procedures, tools, and frameworks for risk assessment, monitoring, and accountability during emergencies. The WHO has been criticized for what has been described as its slow response to the Ebola outbreak in West Africa. More than 8,500 people have died since the start of 2014 from the virus, mainly in Sierra Leone, Liberia, and Guinea. Established as part of the UN in 1948, the WHO's stated role is to provide leadership and technical support to the world's governments on matters critical to human health. Currently, however, that role does not explicitly include maintaining and promoting global health security. The Executive Board's three-day meeting in Geneva is looking at a number of proposals to reform the body. Possible initiatives include the creation of a rapid response team to deploy when an outbreak like Ebola occurs, streamlined recruitment procedures, and the creation of a special fund dedicated to public health emergencies. Charles Clift, a global health security analyst at the UK-based think tank Chatham House, and author of a report on reforming the WHO, said organizational changes were desperately needed. "It is an important function of the WHO to be the leading body in trying to take the right steps when an outbreak occurs," he said. The WHO has also been criticized over the source of its funding, with a few rich countries and groups like the Bill and Melinda Gates Foundation now providing a large part of its budget. "If those countries decide to do something, then they can essentially bring about change in the organization," Clift said. "If they are happy with the status quo, or not sufficiently motivated to change it, the organization will stay as it is."